Hi, my name is Ann Morrison, and I am an optometrist at The Ohio State University College of Optometry.
I'm Dr. Jennifer Smith, and currently I'm a teaching fellow at the University of Houston College of Optometry.
Currently, I oversee medical operations as well as clinical operations for all of Johnson & Johnson Vision.
I had no research experience prior to optometry school or during optometry school, really, and I really learned to love it. I had no idea it was something that I would really enjoy. And so the master's degree was a great way to just dip your toe in the water with research to see if it's something that you really enjoy. And I did. And I loved it so much that after I graduated with my master's in May of 2016, I directly enrolled to the PhD program here at Ohio State.
This was something that I knew I wanted. It was spurred by a patient that I saw during my residency who came in thinking that he only had a cataract, and indeed he actually had proliferative diabetic retinopathy, and it kind of just set off a fire in me where I really wanted to learn more about diabetes and diabetic eye disease, how it manifested, and to see if there was anything that I could do to try to figure out ways to prevent it.
During my cornea and contact lens residency, I had the amazing fortune to work with some of the greatest academic researchers in optometry. This opened the door for me to learn how industry research works. It also opened the door for me to meet people in industry, so when I completed my master's degree, I applied and was accepted for a job at Johnson & Johnson Vision, then Vistakon.
Without these research opportunities, I would not have really learned how much I love teaching and how much I want to stay in an academic setting that allows for direct teaching. Being a part of clinical research really allowed me to build great relationships with patients in my study or subjects in my studies. And so while I might not have had, relationships with as many patients in clinic, I was able to develop really wonderful relationships with families and participants in my studies.
Research has also shown me a completely different side of optometry. There's so many things that optometry does, and in terms of the research world that the research looks at and investigates, that I didn't really know what was going on until I started the program. Electrophysiology really is a niche of optometry because there are very few clinics where I am here in Houston, Texas, that will do this type of testing. So we get referrals from all over Texas. We'll get referrals in other places nationally, and sometimes people will come internationally to get the testing done here.
When I first joined industry, I saw patients, wrote protocols, worked with statisticians to analyze data, and presented back to our teams what happened with our products. Over time, I took on more and more responsibilities, more projects, eventually going into evidence generation and working with marketing on product claims, and then medical affairs, some medical safety, eventually heading up the Department of Medical Affairs for Johnson & Johnson Vision Care. I have the privilege of overseeing dozens of clinical trials at any one time, all of which are developing new products and innovations to help patients around the world.
I also am spending a lot of time working in a medical practice here in Columbus. I am screening for a clinical trial that I'm running, and the screening involves working with 2-month-old infants. And so I spend a lot of time at this medical practice with pediatricians and screening these babies. And if they happen to qualify, I'm then having them here at Ohio State for follow-up visits. If they're enrolled in the study, I am often spending my week seeing a couple of them, collecting data for this long-term study.
Diabetes is definitely an epidemic, and it is something that can have devastating effects on the whole body, but also vision. And so it's just important to me to try to do something about it, to try to, in any small way that I can, add something to the research and optometry community that would help, stifle some of this progression in vision loss due to diabetes.
I think it's important for optometrists to be able to independently evaluate the evidence before them in the research to best care for their patients.
There are so many unanswered questions in clinical practice. Why don't we prescribe for hyperopia uniformly? Why isn't there a cure for glaucoma yet? There's still so many unanswered problems in vision science and optometry. I find it very rewarding and fulfilling to think that my research and the work that I'm doing can help answer these questions that then impact our patients.